Welcome to COVID Conversations, where we discuss the latest COVID-19 news with the experts. They're labeled as long haulers, people experiencing post-COVID symptoms for extended lengths of time. Some suffered from severe COVID complications during their infections. Others showed no symptoms at all. So far, the reason behind what many are calling long COVID remains a mystery, but medical experts are working to understand what it is and what it means for those grappling with these sometimes debilitating effects. Jason Maley is a physician in the Division of Pulmonary Critical Care and Sleep Medicine at Beth Deaconess Medical Center. He's also the director of the new Critical Illness and COVID-19 Survivorship program at BIDMC. He joins me now. Dr. Maley, welcome.
Thanks so much for having me.
Today's question is, what is long COVID?
So long COVID, although there may not be a formal definition, practically speaking, is patients who have had COVID-19 and then after their initial illness, they may experience continued symptoms, or they may feel like they've recovered and then develop new persistent symptoms that really have a huge impact on their quality of life and can last for, in some cases, months or even a year after their initial infection.
What are some of those symptoms? What do they look like? What, if someone might be experiencing this, what should they be looking out for?
So most often patients experience fatigue and severe exhaustion after minimal activity. They may have difficulty with their thinking. Brain fog is a term sometimes patients may read, where the thinking feels foggy. They lose track of their thoughts easily. They have difficulty with short-term memory. Fast heart rate is another common symptom, and breathing discomfort, feeling like you can't take a satisfying breath or having a sense of discomfort or shortness of breath is very common. And then head to toe, really people have experienced a huge range of symptoms. Many people lose their smell when they first have COVID-19, and that's something that was recognized a few months into the pandemic as a somewhat unique symptom that patients were having. And months later, some patients still haven't recovered their sense of smell, so that's another symptom. Other patients experience difficulty with digestion, pain in their hands and feet, and really almost anything head to toe people have described as a potential sequela of COVID.
I've heard anecdotally, young, healthy individuals who maybe were asymptomatic and tested positive and thought, okay, I had it, I'm going to do the quarantine. But then a couple of months later, I can't go for a run. I can't go up the stairs. Is it targeting a particular group of people, or is it really kind of, it could impact anyone?
Yeah, that's a great question. It's hard to know for sure. Most patients we see are between 20 to 60 years old. So they tend to be younger. They generally are previously very active. And it's hard to know for sure if that's just a result of those people most notice the changes and are most active with work and with their life, and so they're most bothered by it, or if truly there's something unique about the way the virus has affected those patients compared to, say, an elderly person who we're not commonly seeing those patients in our complain of these same symptoms. As people have seen with COVID and with other infections prior to COVID, it's hard to predict the way any one person will respond. Some people have no symptoms from the exact same virus that puts other people in the intensive care unit. And there may not be other clear differences between those two people. They may be the same age and have the same risk. So we think possibly changes in vaccine response or differences in how brisk the immune system, the infection fighting system, responds to the vaccine. And that may relate to also why different people, different ages, develop long COVID symptoms.
That being said, now that we're talking about vaccines, do you believe that vaccination will potentially help eliminate these long COVID, these lingering symptoms?
So we strongly recommend the vaccine for all of our patients who are eligible for it. And it's a very common question and has gotten a lot of attention recently, the potential impact of the vaccine on long COVID itself. It's not known at this point, and it's really an area where it's hard to say too much except what we've observed. So we've seen some of our patients feeling like there's a dramatic and really sudden change in their symptoms improvement after getting the vaccine. patients who have had loss of smell for months and it returns after they receive the vaccine. That's been observed elsewhere too. There have been some informal surveys on social media of these long COVID survivor groups. And in those surveys, about a third of patients report that several weeks after the vaccine, they've had a significant improvement in their long COVID symptoms. Most people have not noticed a major difference, and less commonly, there's been a sense that their symptoms worsened. And so because of the benefits of the vaccine on COVID itself, and also potentially an effect on long COVID, we strongly recommend all our patients get the vaccine.
Excellent, excellent. There's so much to learn. There's so much to understand. But the COVID-19 survivorship program is brand new, first of its kind, most comprehensive, at least in New England. Where it's amazing work that you are doing with your team. And thank you so much for joining me to speak about this and give people a little bit more information.
Yeah, thanks so much for having me.
No problem. This is COVID-19. This is COVID Conversations, where we discuss the latest COVID-19 news with the experts.